Early detection is vital in beating a cancer diagnosis, and that is especially true for breast cancer. So the OhioHealth system of hospitals, along with NBC4, want you to think about your breast health. And OhioHealth is doing what it can to reach out to some of the most underserved members of our community, women who don't have access to breast cancer services. Joining me this morning, Dr. Jason Fox, an OhioHealth radiologist, along with Leslie Steele, who is a director of breast health for OhioHealth. Welcome to both of you.
Thank you for having us.
Dr. Fox, I'm going to start with you because there still seems to be confusion, and part of it is because new research keeps coming out with different things about breast health. When should women start to get that first exam, and then how often?
Well, we recommend that women get their first examination starting at 40 and then every year afterwards. They should also perform monthly self-breast exams, and they should have a examination performed by their physician every year.
Women sometimes do find through self-exams, don't they?
Absolutely.
And there's always surprise, like I really didn't think I would, but they can.
Absolutely. I can't tell you how many times that we've helped women that just come in from finding it on their own and, probably save their life from it.
And because of that, that's where you make save your life, because early detection is key here, isn't it?
Key. It's absolutely key. We're curing breast cancer now instead of just treating it.
Isn't that wonderful?
It's great.
As a doctor, I'm sure it's got to be.
Yes.
It's wonderful to be able to bring that diagnosis, but then the outcome to your patients. So, Leslie, then you are working with women all over. I mean, what'd you tell me? 35 counties that OhioHealth works. I was amazed at the outreach. And that's what it is. You're reaching out to women who don't have access. And how are you doing that?
Well, OhioHealth has partnered with the Susan G. Komen for the Cure Foundation, the National Breast Cancer Foundation, and then the American Cancer Society. And we've partnered together to provide screening, diagnostic, and breast ultrasound to those that are underserved throughout Franklin County and the contiguous counties.
How do they get those services?
Basically, we are on a campaign to inform physicians and clinics and local businesses, etc., of this campaign, and then essentially the patient would just simply call our central scheduling number, which is 614-566-1111, and make them aware that they've heard about the program and that they are in need of a screening mammogram, or they found a lump and they're in need of a diagnostic mammogram, etc. Once they do that, we'll schedule them at any of our 10 locations, which is closest to them, and hopefully get them on their way to good health.
Wow, that is wonderful news. And it says women who need financial assistance. So even if you have some sort of insurance, but the insurance isn't necessarily covering this, are you eligible?
Yes. Some women find that the co-pays that they have make it too difficult for them to go in and have their mammogram. So we want to try to eliminate any type of an excuse, if you will, that you would put off a mammogram, because we really feel that it saves lives, and we want to get you into one of our centers and get screened. Now,
there may be some women who, 60, 65, who have never had a breast exam, and they say at this point, well, I don't need one. What's your answer?
Everyone needs a mammogram, beginning at age 40, yearly thereafter, and they should get a clinical breast exam yearly by their physician as well.
Dr. Fox, what do you say to those folks?
65, if you haven't had one, go get one. Mm-hmm. You've been fine so far, but your risk of breast cancer increases as you age. And,
So that is true. That is
yes,
a fact.
That is a true fact. And just because you're 65, you still have a long life ahead of you. Don't waste it by not going and getting your mammogram.
Well, I'm sure, Doctor, you've also heard women say, but it's kind of a discomfort. It's kind of a pain, literally. I don't want to bother. And you say to them...
I personally experienced it, but we do use digital mammography at all our sites. We have mammopads, which significantly reduce the discomfort that people have having the mammograms. Questions, I speak with a lot of the patients after the examination. We have a nurse practitioner that also helps answer any questions, set up any additional appointments if they need any additional appointments. They can help with transportation. They can answer any questions about insurance that you have. They're very helpful.
And Leslie, back to you. If someone does find something and they've already gone for the screening because they don't have any money, what if they need help following that? Can OhioHealth do anything about that?
OhioHealth will work with all patients that are in need. So we have a process that calling that 566-1111 number will get you through that process. This assists with the initial stages to help get you screened. And then if you would need to come back for a diagnostic or a biopsy, we're there to help you. So,
how many women did you help last year?
Last year, we performed over 500 free imaging exams on women throughout 35 counties throughout Central Ohio. So we hope to increase that drastically. And like I said, it's very important to get screened, so we really want to make sure the message is out there.
Well, we've got the phone number up, and we've had it up there. So hopefully if there are women and men, sometimes that's...
Absolutely.
You've seen that too, that they will give you both a call. Leslie, Dr. Fox, a pleasure to have both of you here.
Thanks for having us.
Thanks.